Mpox now a global public health emergency. The World Health Organization (WHO) has declared the current Mpox outbreak a public health emergency of international concern. Is the highest level of alarm under international health law. Addressing a media briefing on Wednesday, WHO World Health Organization Director General Tedros Adhanom Ghebreyesus said, "Last week I announced that I was convening an emergency committee under the international health regulations to evaluate the upsurge of Mpox in the Democratic Republic of the Congo and other countries in Africa. The detection of the rapid spread of a new clade of Mpox in eastern DRC, its detection in neighbouring countries that had not previously reported Mpox, and the potential for further spread within Africa and beyond is very worrying. In addition to other outbreaks of other clades, the emergency committee's advice to me and that of the Africa Centers for Disease Control and Prevention, which yesterday declared a public health emergency of regional security, are aligned. Mpox is a viral illness caused by the monkeypox virus with two distinct clades, Clade 1 and Clade 2. Common symptoms include a skin rash or mucosal lesions lasting 2 or 4 weeks, fever, headache, muscle aches, back pain, low energy, and swollen lymph nodes. The virus can be transmitted to humans through physical contact with infectious person, contaminated materials, or infected animals. The Africa CDC said the decision comes after at least 13 African countries, including previously unaffected nations like Burundi, Kenya, Rwanda, and Uganda, has reported Mpox outbreaks. These countries have confirmed 2,863 cases and 517 deaths from 2024, primarily in the Democratic Republic of the Congo (DRC), the organization said. According to the Africa CDC, suspected cases across the continent have surged past 17,000, a significant increase from 7,146 cases in 2022 and 14,957 cases in 2023. The South African National Health Department last month said the disease remained under control locally and confirmed 22 Mpox cases, including 16 recoveries, 3 deaths, and 3 active cases. National Health Department spokesperson Foster Mohale on Wednesday said South Africa was among participants in an emergency meeting by the World Health Organization where different countries, including South Africa, were presenting. This is a closed meeting for countries to present the state of Mpox to enable the World Health Organization to make an informed announcement, Mohale said. Africa CDC Director General Dr. Jane Kaseya emphasized the urgency of swift and decisive action. We declare this PHECS to mobilize our institutions, our collective will, and our resources to act swiftly and decisively. This empowers us to forge new partnerships, strengthen our health systems, educate our communities, and deliver life-saving interventions where they are needed most. There is no need for travel restrictions at this time. The CDC said from May 2022 to July 2023, Mpox was declared a public health emergency of international concern (PHEIC) by the World Health Organization. However, Africa did not receive the support it urgently needed during this period. As global cases began to decline, the escalating numbers in Africa were largely ignored, the Africa CDC said. Kaseya explained that the emergency declaration follows wide consultations, including an anonymous decision by the Africa CDC Emergency Consultative Group (ECG), chaired by Professor Salim Abdul Karim, head of SAPRISA, an AIDS research program based in Durban. Karim highlighted that the limited surveillance and evidence suggested the situation could be more severe than currently understood and raised concerns about the rising facilities, particularly the potential link between HIV and Mpox. Our concern is that we may be seeing more facilities in Africa due to the association with the HIV, he noted. Cross-border transmission to previously unaffected countries was also a concern, promoting the ECG to urge the strategic distribution of the limited vaccines available. Mpox spread in South Africa, a cause for concern. Disease outbreak and pandemic unpreparedness is the bane of cracking global health systems irrespective of their economic status. The once-in-a-century COVID-19 pandemic, which hit the world in March 2020, brutally exposed the inadequacy of public and private health systems, although in a twisted way it unleashed human ingenuity in developing a vaccine in a record 1 year, instead of the normal decades or so gestation of bringing a major drug to the market. Vaccine deniers and skeptics apart, ideological hubris, bureaucratic complacency, and policy drag and not option. South Africa, for instance, is amid a wave of community transmission of Mpox following its reporting to the World Health Organization a few days ago of 20 confirmed cases between 8th May and 2nd July 2024, including 3 deaths with a case fatality ratio (CFR) of 15%, largely concentrated in Gauteng and KwaZulu-Natal. The sudden appearance of unlinked cases of Mpox in South Africa without a history of international travel, the high HIV prevalence among confirmed cases, and the high case fatality ratio suggests that the community transmission is underway, and the cases detected to date represent a small proportion of all Mpox cases that might be occurring in the community, according to the World Health Organization in a disease outbreak notice. The reality is the authorities do not know how long the virus may have been circulating. This, says the World Health Organization, may in part be due to the lack of early clinic recognition of an infection with which South Africa previously had little experience due to the ongoing global outbreak, potential perceived symptomatic manifestation, present few symptoms of the disease, or delays in care seeking due to limited access to care or fear of stigma. The tragedy is that vaccination as an effective disease control and viral transmission mitigator is a proven tool in the fight against a range of pathogens. A new World Health Organization Europe retrospective surveillance study published in the Lancet Respiratory Medicine Journal early this month showed that from the time of their introduction in December 2020 through to March 2023, when the Omicron variant was dominant, COVID-19 vaccines reduced deaths due to the pandemic by at least 59%, saving more than 1.6 million lives in the World Health Organization European region. This means that had the World Health Organization Europe region not resorted to the use of vaccines, the COVID-19 death toll could have been 4 million instead of the actual 2.4 million. Most of those saved were aged 60 or older, the group at highest risk of severe illness and death from SARS-CoV-2. This latest Mpox outbreak in South Africa is inextricably linked to the country's high HIV/AIDS prevalence, including about 30% of same-sex male transmission, of whom only 44% are on antiretroviral therapy. This makes this group extremely vulnerable to severe Mpox disease and death. There is also a hazard of health workers if they are not appropriately using PPE when caring for patients with Mpox. The World Health Organization is concerned about the extremely high 15% CFR among cases reported in South Africa in 2024, as most detected cases are among persons who are immunocompromised with uncontrolled HIV and other comorbidities. Vaccinations with the 2 available Mpox vaccines have been shown to be effective. But World Health Organization remains concerned that the Mpox outbreak in South Africa will continue to evolve given the high likelihood of underdetection and underreporting of local transmission, given that reported cases have to date almost exclusively affected the most vulnerable and have presented with severe disease and extensive skin lesions, which could lead to more viral transmission and risk poor outcome for the patients. In this respect, World Health Organization's invitation to Mpox vaccine manufacturers to submit an expression of interest for emergency use listing assumes much greater importance given the worrying trends in the disease's spread, including in Africa. And that's it from Injibs Africa. Stay tuned to our USA and political updates.